Welcome. Here's an introduction to HHRG and what it's all about. HHRG is a growing network of quality healthcare services and program providers. Our ultimate goal as an organization is a pact that drives us to be the best in the industry. P is for prevention of disease exacerbation through the education of employees and patients. We provide training and programs to alleviate the worsening of symptoms and prevent the preventable. A stands for avoid rehospitalization through constant review of service outcomes. We stay on top of our patients' conditions by constantly monitoring results and the commitment to the plan of care. C is for create programs and protocols when gaps in care are identified. Healthcare gaps are ever present. Thus, we continuously identify these gaps and provide an extra layer of support. T stands for thrive with ease, using our innovative solutions and technological advantage. By combining our programs with technology, we want our patients to get better and be comfortable in the most convenient way. HHRG is your partner of choice in post-acute care and chronic disease management. From 2012 to the present, we have grown and expanded to over 20 companies. We are one of the fastest growing companies in the home health industry in California. The HHRG infrastructure includes home health, home care, hospice care, palliative care, outpatient home therapy, business processing office, software development, remote patient monitoring, medical devices, and residential care facilities. Our quality care programs are created, delivered, and captured through this infrastructure, enabling us to provide our patients with the best care possible. Our services. Supported by over 25 years of home health and hospice experience, we offer full-spectrum patient care management and services that have been rated with 4.5 to 5 stars by Medicare. Home health care. What is home health care? Home health care is skilled care delivered directly to a patient's home for the purpose of treating or managing an illness, injury, or medical condition. This type of care is provided by licensed medical professionals, including registered nurses and LVN, physical therapists, occupational therapists, speech therapists, home health aides, and medical social worker. Some examples of skilled home health services include wound care for pressure sores or a surgical wound, patient and caregiver education, intravenous or nutrition therapy, injections, and monitoring of serious illness and unstable health status. In general, the goal of home health care is to treat an illness or injury. Home health care helps to get better, regain independence, become as self-sufficient as possible, maintain the current condition or level of function, and slow the decline of a condition. Our signature home health programs are the SMART or the Specific Management of Ailments and Rehabilitation Treatment for Nursing Program, STAR Program or the Strategic Treatment and Aided Rehabilitation for Therapy, and the HOPE Program or the Hospital Occurrence Prevention Enforcement. Our clinical team follows a blueprint of a comprehensive care plan to reduce hospital readmission rates and preventable emergency department utilization. We aim to increase patients' and families' engagement by providing them with quick guides, booklets, and kits for diseases that have been identified as the frequent causes of rehospitalizations. Under our SMART program, the patients are given medical devices as needed to help monitor changes in their conditions. They are coached to do daily self-monitoring based on relevant health metrics that would help our clinical team to better evaluate patients' progress to recovery. This also enables us to capture the early manifestations of exacerbations, thus preventing ER visits and rehospitalization. Hospice care. What is hospice care? Hospice care is a philosophy of care that focuses on patient comfort and quality of life rather than curing the patient's disease. Care is provided to someone with terminal illness and life expectancy of 6 months or less. It is typically given in the patient's home, but also may be given in inpatient hospice units. The hospice team is comprised of the medical director, social worker, case manager, hospice aides, and homemakers, spiritual counselor, and the physical, occupational, and speech therapists. Our hospice care services include comforting care provided by an interdisciplinary team, pain and symptom management, psychosocial and spiritual support, medications, equipment and supplies, patient and family education, comforting treatments, therapies, and bereavement support services. HHRG's unique hospice programs. Our hospice care team follows pathways of a comprehensive and individualized care plan to meet the unique needs of the patient and family unit. We offer comprehensive and holistic approach that helps patients and loved ones navigate the changes and challenges that accompany life-threatening illnesses and end-of-life care. Introducing CALM, a program brought to you by our hospice care team to ensure that your loved ones are provided with the ultimate care and compassion at the time that they need it most. The CALM program stands for Comfort, Assistance, Life, Management. The ACT program stands for Advanced Care Treatment Program, a palliative care program designed specifically for patients and their families who are not ready to accept hospice care. This type of care provides comfort, emotional support, and symptoms management to help the patient live each day to the fullest by making them feel comfortable. What is palliative care? Palliative care is a specialized medical care for people living with a serious illness, such as cancer or heart failure. Patients in palliative care may receive medical care for their symptoms or palliative care, along with treatment intended to cure their serious illness. Palliative care is meant to enhance a person's current care by focusing on quality of life for them and their family. Who can benefit from palliative care? Palliative care is a resource for anyone living with a serious illness. Palliative care can be helpful at any stage of illness and is best provided soon after a person is diagnosed. In addition to improving quality of life and helping with symptoms, palliative care can help patients understand their choices for medical treatment. The organized services available through palliative care may be helpful to any older person having a lot of general discomfort and disability very late in life. Outpatient home therapy. What is outpatient home therapy? Outpatient home therapy occurs when a physical therapist comes to your home to provide rehabilitation services. Unlike home health therapy, this type of service is not only for patients who are unable to leave the house to attend PT, but also for patients who can leave home but prefer to receive therapy at home. HHRG's outpatient home therapy services includes assessment and evaluation of status, recommendation and use of assistive devices, prosthetics and orthotics, instruction in gait, transfer, and other mobility skills, exercises to improve balance and coordination, muscle re-education and muscle spasm relief, prevention of falls and safety promotion, implement post-surgery protocols, range of motion, and teach and train caregivers. Other services we offer: a mobile PT van and state-of-the-art PT equipment. Home care. What is home care? Home care is a non-medical caregiving and assistance provided in the client's home. Care may include assistance with activities of daily living, such as bathing, transferring, and meal preparation, transportation, companionship, and more. It does not include medical care or therapies. Depending on the client's needs, they may receive assistance from a home care aide anywhere from 1 hour a week to 24 hours a day. Our home care services include personal care, bathing and grooming, light housekeeping, laundry and cleaning, cooking and meal preparation, medication reminders, companionship or escorting, non-medical transporting, administrative assistance like assisting with phone calls and household incidental duties, home and environment safety inspections, sorting and organizing, leisurely activities like gardening, reading, outings to the senior center, errands, and shopping. Our services are also offered to independent clients who require very minimal assistance but need supervision in their own private homes, or in independent and assisted living communities, and non-medical assistance for clients in hospice and palliative care condition. RCFE. What is an RCFE? RCFE stands for Residential Care Facilities for the Elderly. They serve persons 60 and older. They provide room, board, housekeeping, supervision, and personal care assistance with basic activities like personal hygiene, dressing, eating, and walking. Facilities usually centrally store and distribute medications for residents to self-administer. All Providence homes RCFE offer private or shared rooms, recreational activities, engagement, safety and security of residents and caregivers, dementia care, respite care, hospice waivers, and palliative care. RCFE services include personal care, bathing and grooming, housekeeping and laundry, medication reminders, cooking and meal and snacks preparation, and companionship. Health Connects RPM or Remote Patient Monitoring. We combine technology with our home health care practice to improve the outcome of our service. Our team will continuously monitor and coordinate the health metrics and notify the physician if the patient's readings go beyond the set threshold. Our Bluetooth and Wi-Fi enabled RPM devices include blood glucose monitor, blood pressure monitor, weighing scale, O2 sat and pulse oximeter, and thermometer. We cover a wider range of territories in California. We have capabilities to serve patients and families living in the greater metropolitan cities. Covering such a large area offers us the opportunity to provide more services and allocate more resources to the communities we serve. For more information about HHRG and its affiliates, connect with us. Call 1-877-232-0807 or visit us at www.hhrgconnect.com.